Louis Ekome is an international strategic healthcare consultant at Russia, where he has been instrumental in enhancing the healthcare ecosystem across multiple countries for over a year. With more than 20 years of experience in the life sciences sector, Louis specializes in general management, strategic consulting, project management, and product development. In his role at Russia, Louis has been pivotal in designing the waste cost assessment framework for laboratories in Africa, collaborating with organizations like the CDC and Global Fund. His previous roles at renowned global organizations such as Janssen Cilag, a Johnson & Johnson company, Sanofi, and IQVIA involved building innovative business divisions in Nigeria and West Africa, as well as significantly contributing to the development of national management guidelines for various disease conditions, including psychiatry, gastroenterology, community-acquired pneumonia, and malaria. Louis combines his expertise in marketing, sales, and business development to create impactful strategies that enhance business outcomes and optimize resource allocation. His leadership style fosters collaboration and empowers teams to achieve their highest potential. Based in Nigeria, Louis holds a Bachelor of Pharmacy and an MBA Marketing. He is a certified Lean Facilitator and Lean Practitioner, and he holds a certificate on International Leadership and Organizational Behavior from SDA Bocconi School of Management, Italy. He is married with 2 children and enjoys reading and organizing cycling tournaments in his spare time. With a commitment to driving impactful change in healthcare systems, Louis Ekome continues to be actively involved to shape the future of the healthcare industry. Ladies and gentlemen, let's make a resounding welcome to the HealthyU Summit 2024, Louis Ekome.
Good afternoon, distinguished ladies and gentlemen. And congratulations, 9 years, not be joke. And congratulations to all of you also. And thank you very much for having me. It's indeed a privilege. We do not despise the days of little beginnings, and it's really amazing to see, what you guys have really done here, and it's really, really great. And congratulations, big congratulations. I was just looking at your, when I was looking at your product flyer, and I just had a flashback. Hello. So I was just having a flashback, when we're still having children. So we've stopped doing such things. So, I actually had a nanny, and I came back one day, and they were like, this lady, very, very, very nice lady, it's really great, a great nanny, all right. And you were like, I can't even remember exactly how the story went, but something like about spitting blood or something. I'm like, wahala, wahala, wahala. So took the lady to the laboratory, and lo and behold, as suspected, the lady had tuberculosis, But I mean, that's the thing with diseases. It does not look at face and say, because you're a nice person, I'm going to skip you. All right. So I was so happy, when I saw that, because, that nanny package on your product, because, way back, we didn't used to have such things. You just see somebody, you just, get somebody. But this helps us to know. All right. So it doesn't mean that somebody who has a condition cannot walk, or how did Prof put it, a disorder, cannot walk. But it's just so that and you know where the person fits in. So well done, and thank God for the journey. So today we're talking about good medication practice, all right? And as a key to effective health management. That's what I'll be speaking on. And when we talk about medication, we are talking about medicines. So medicines that you are taking that has been, the idea is that it has been given to you by a recommended medical practitioner, all right? So you are taking that medicine for, a specific condition. So when we talk about good medication practice, we are talking about using medicines safely, using them correctly, using them effectively to improve one's health. Now, this is important because when people take medicines well, what happens is that they get faster, better. And when somebody gets faster, better, they can begin to take care of their families better. They can go back to their normal business, okay? And then it can also reduce complications, all right? So when people take medicines well, it can reduce complications, all right? And then improve the quality of life. So what are the key steps? So when we say good medication practice, okay, what are some things to watch out for? So the first thing is that follow the doctor's prescription. All right. So at times I forget that I'm a pharmacist. So if I'm a pharmacist telling you that you should follow the doctor's prescription. So take it exactly. So if it says it should be taken this time, please take note of it. All right. Do not stop your medications or change your medications and say, I'm feeling better. Especially for people who take antibiotics, something happened, all right? You say, as I took it for 2 days, the thing now disappeared, so I now stopped taking it, all right? And then for certain kind of infections, you tell the doctor will say, take this thing, even when the thing has disappeared, keep on taking the medicine, all right? At worst, let me just put it that way, ask, why should I, if it has gone, why should I keep taking it? All right. And even if the doctor does not have time, okay, you can ask your pharmacist, who will give you the medicine. Why do I need to keep on taking it, for this period of time? All right. So it's an issue because Prof mentioned, she talked about chronic diseases and acute diseases. All right. So chronic is been there for some time. Acute, it comes and then it goes, something like malaria. All right. And then certain kinds of infections for which you take antibiotics. All right. So when people take antibiotics, it can, because these are microorganisms. Okay. So what happens is that the job of the antibiotics to make sure that those organisms, they reduce and then ultimately die, in a lot of instances. In some instances, it is to bring it between, a controllable level because, that is how God has designed the body, for that microorganism just to be there. All right. So when people don't take those medicines, what will happen is that is how we say for antibiotics, that's how resistance comes, all right? Because, that organism did not die. So it comes back stronger because it's used to that antibiotic. So what will happen is that at times when you run tests, in the laboratory, you see that it's resistance to all the antibiotic on your antibiogram. You're like, okay, so what do we do now? For this kind of patient, it becomes a confusion. Okay, it might not even be the person who has taken, but because of what is available in the environment. So this is very key. So follow the doctor's prescription. All right, it's very, very important. A lot of people will say, I don't abuse medications. I think one of the most common abuse medication is paracetamol. So everybody knows when you have a headache, yes, because when you have some medications, the law allows you, when anybody has any condition, any disorder, the law allows you can walk into the pharmacy and ask for medication. So you can go in and get paracetamol. They are called over the counter. You can go and get some certain kind of cough syrup. You can go and get anti-malaria drugs, here in Nigeria. In some countries, you need a prescription before you can get an anti-malaria, okay? So, but paracetamol, you say lots of people come in. And so because, yes, I mix work, and then there was a time I was also in some sort of practice, part-time. One of the most common I see is that people come in, and for some strange reason, is women. It's just like they're the ones who take care of their children. I don't know what the fathers are doing. So the mother is like, like you have given the child paracetamol. What did you give the child? I said, I gave the child. I said, was it tablet or syrup? I said, tablet. I'm like, okay, what did you give the child? I gave the child 1 tablet. I gave the child half tablet. I'm like, because when you look at, I'm like, do you know that this thing has a dose? All right, it has a dose. The dose, the quantity you are meant to give the child is based on the age of the child. Okay, because the organs are still developing. You take paracetamol too much, you will destroy the liver. The liver does a lot of things. It does digestion. It stores vitamins. Even drugs, metabolism of drugs. It purifies the system. Even it helps to form blood. There's a lot of things that the liver will do. All right? So, follow the doctor's prescription. Ask questions about your medication. That's what Prof said. Okay, ask questions about the drug. If you go to any hospital, they say doctors have very bad handwriting. I tell you that even at times, we pharmacists, we don't see what they are writing. And we have to ask them, say, please, tell the doctor to... So at times, just to be on the safe side, so that we will not give you. Because what you are going to see is that at times, different hospitals have their different shorthand. So you cannot use shorthand that for one hospital to use to transcribe to another. So that I won't give somebody something that you don't know. So ask your doctor. So doctors have different reasons why some will say, we don't want to write what you are. No, that we don't want you to know what you are taking. taking. No, that is medieval medicine. If anybody asks you who said it, tell them it was Louis who said it. Okay, you need to know what you are taking, and Prof has explained, because there are so many factors that can happen at different times. If for any reason you even have to go somewhere else, you need to have your medication history so that they'll know what exactly you have been taking. So if you go to any hospital and you don't know what you are taking, please, it's a red flag. If you're unsure, ask your doctor or your pharmacist. Keep a list of what you are taking. All right, keep a list of what you are taking. You will say, this mama. Just keep a list. I tell you that even I know some academic professors, I'm like, how can you not know the medications you are taking? All right. So you have to keep on labeling the thing, very well. Keep a medication list, because you never can tell. Some of these drugs, when people take more than one medication, at times they cancel themselves. They are fighting. So you need to know. The doctor needs to know, all right, what you are taking, so that he can know what exactly to give you. If maybe you were in a certain hospital and you didn't know, it becomes a challenge. All right, it becomes a big challenge. Of course, we say store your medicines well. The ones that need to be in the fridge, be in the fridge. The ones but generally you say keep in a cool, dry place. Keep medicines well. Ensure that they are out of the reach of children. Some medicines are very sweet. Before you come, your child has drank, the entire medicine. A lot of syrups are made with alcohol. All right, because it's a good thing to dissolve medicine. It's easier. All right, so a lot of medicines are dissolved in alcohol. All right, so that's why at times you see some paracetamol, they'll tell you it's alcohol free. All right, so they are sweet, they are tasty. The child will take it and keep on taking the medication, but and keep them out of the reach of children, because they don't know better. Stick to your medication schedule. If the doctor says take it in the morning and then take it in the afternoon, take it in the evening, he has a reason why, or she has a reason why they are saying take it that way. All right, because the drug does not remain in the system. After some time, it is clearing. So they have a good reason to tell you how to take the medications. At times, because of, like Prof said, there are different people have different disease conditions. Even for him, when he talked about people who might have different conditions, they see people with different conditions. The way you would prescribe for one is not the way you would, prescribe for the next person. So schedules are different, and that is why we discourage people from transferring medication. You say, when I had this thing, Mama Rose, when I had this thing, this was exactly what the doctor, the way I describe it now, that's just the thing. And then people will be sharing medication, all right? But the conditions are not the same. So you cannot say because this is the thing. I mean, you know how we like to do over Sabi, especially in Lagos. You don't necessarily say you don't know. You just want to show that you have that knowledge. So please, don't stick to your medication schedule, all right? Miss schedules, all right? When you miss a schedule, it can reduce the efficacy of the drug. You now say it's not working. Where there are side effects, so if you take it and you begin to feel somehow that the doctor did not tell, did not plan, all right? Let somebody know. So at times, if you have the energy, if you look at the pack of the medication, it will tell you, some things that should happen. What the doctor would have checked is that, okay, this thing will not kill this person, but it is better, let them survive, and then, or take the medication. And then based on the condition, so there's people, we call them maybe like special populations. So people maybe who might be pregnant, people, children, or people who can have certain conditions. All right. So the doctors might decide to recommend the medication in a certain way. So if anything goes out of the norm, please let them let the pharmacist or the doctor know. Don't ignore symptoms. We've already talked about self-medication and then sharing medications. Don't share medications. Don't transfer. We are talking about good medication practice, and I said at first that the assumption is that it is for a condition which you have been given the medication. So I'm not necessarily talking about drug abuse in this instance, all right? But that can also enter because people take a lot of things, especially like young men. You see people who take performance-enhancing drugs, and the irony is that it is the bachelors that take it more. I don't know which performance you want to enhance when you do not have license to perform. You are still the one that is enhancing on the enhanceables. So please, all right. So, but let us leave that one in the park. So, just to round off anyway. So, good medication practice helps health. When you take medicines the way your medical practitioner, your doctor, has asked you to take it. All right, it's better. it prevents worsening of the illness, okay, and then there's faster recovery. It prevents and reduces unnecessary hospitalization, okay, so and then saves money. So what happens typically is that at times when medications are taken properly, it can even shorten your stay in the hospital. So because typically when you come into the hospital, that's why most of the time the doctor will start with maybe injections. Then when they notice how things are, they will move you, to oral medications as they prepare to ask you to go so that you can get back to your daily hustling. All right. So good medication practice also ensures safety, patient safety, and then effectiveness of the treatment. So let's remember taking medicines responsibly. Okay, it is very crucial. It is our role. All right, and then we have to partner with our healthcare practitioners. All right, follow prescriptions, stay informed, ask questions. All right, ask questions. If you don't know what a medication is for, ask questions. All right, ask questions. What does this thing do? Why do I have to take it? Things like that. Okay, and I hope that with these few points of mine, I've been able to convince you and not confuse you that good medication practice is key to effective health management. Thank you very much.